What's the scenario we all know about? Guy gets horrible news and he's wailing about something and he suddenly clutches his chest in pain, keels over dead, sudden cardiac arrest. This has never happened. This is like a movie plot. This never occurs in real life. Instead, what actually happens requires you to have like arcane knowledge of high school physics explaining why like toilet bowl plumbing wears out after a while. You got a tube and you got fluid moving through the tube, and by definition, if the fluid is moving through with more force, elevated blood pressure, you begin to get fluid turbulence pounding away on the walls of your blood vessels, causing little bits of pitting and scarring and tearing, and then you get inflammation there, and then that's exactly where like glucose and cholesterol and fat wants to glom onto to clog your arteries. Where's the glucose and cholesterol and fat coming from? That's the stuff you're mobilizing into your circulation in the previous slide. So you get this synergistic double whammy here between the metabolic stress response and the cardiovascular, setting you up for the #1 killer in this country, cardiovascular disease. Now, this link between stress and heart disease is so solid that it accounts for the most famous personality profile in all of medicine. And it's one where basically if you're coming out to a lecture on a perfectly nice evening to be outside taking a walk instead, I suspect it applies to like 80% of the people in this room, which is those of us in here who have type A personality. Okay, type A personality. Type A was first described in the 1950s by a pair of cardiologists in San Francisco, Friedman and Rosenman. Here was their original formulation: time-pressured, hostile, impatient, low self-esteem, joyless striving. Okay, like 90% of us. And what they observed back there in the 50s was if this was your personality profile, you were more at risk for heart disease. Cardiologists hated these guys. You're some like Eisenhower cardiologist, and all you're thinking about is like blood lipids and heart valves, and here are these guys saying, no, you need to sit down your patient and talk to them. Christ, who wants to talk to their patients and talk to them and say, okay, so suppose you're in the supermarket and you pick the line that's moving slowly. Do you go berserk at that point? That's got something to do with heart disease? Total resistance to the concept. And it wasn't until the 1980s that enough studies had been done that it became clear type A is for real big time. If you have type A personality, you are more at risk for cardiovascular disease than if you smoke, than if you are overweight, than if you have elevated cholesterol levels, a huge risk factor. Now, what became clear by the 80s was the critical component in the type A profile, the piece that is the one that contributes to the cardiovascular disease. And it's a term now that is used in the field if you have toxic hostility. Toxic hostility, this attributional style where everything that happens around you is proof that they're out to get you more than everyone else, and the only thing to do is watch your back 24/7 and keep a knife ready. This is the style where you're in the supermarket and you've picked the slow line and you want to kill the son of a bitch kid behind the cash register. Come on. How do you know I have a 1 o'clock meeting trying to screw me up? No, don't ask the old lady how she is today. Come on. I'm going to die someday. If this is what you're doing, instead of checking out the Elvis sightings in the National Enquirer, your blood pressure is going to go up. And if this is what you're doing every time somebody could have held the elevator door open for you but didn't, if you're doing this 40 times a day, you're going to pound away at your blood vessels set up for cardiovascular disease. And these days, the main question in that field is, insofar as you are toxically hostile, what's worse for your heart? Expressing those toxic emotions or keeping them repressed inside? What's clear is expressing them is worse for everybody else's cardiovascular health, but what is the cost of repressing strong physiological emotions? So that's an area of a lot of ongoing research. Okay, so that's stress and heart disease. Actually, how did those guys first figure out about type A personality, given how much that was coming out of left field? And I actually got to hear this story some years ago out of the horse's mouth himself. Meyer Friedman, the cardiologist who first described type A, died a few years ago in his early 90s, saw his last patient a week before he died, was working full-time at a cardiology unit, UCSF Medical Center. As he used to say, I'm still type A, but I'm a type A tortoise now. And here's the story he would tell. in the 50s, he and his partner had this cardiology practice. Everything was going great, except for this one weird thing, which is they were spending a fortune having to reupholster the armchairs in the waiting room. What's this about? Who knows? Whatever. It's part of the overhead. Every month this upholsterer comes and there's a chair or two that needs to be fixed. One month the upholsterer is out on vacation. Replacement upholsterer comes in, takes one look at the chairs and discovers type A personality. He says, "What is wrong with your patients? Nobody wears out chairs this way." And they have one of them left. And as you can see here, the front 2 inches of the armrests and the seat cushions are totally shredded, and the rest of the chair is perfectly fine. It's like every night there's like dwarf beavers in there clawing away their chair. What is this? This is the type A profile. This is somebody with type A personality. This is what they do to a chair when they're waiting in the waiting room with their cardiologist to hear if there's bad news or not. This is not just figuratively, but literally sitting on the edge of your seat and squirming and clawing and all of that. This is what somebody who's type A does to a chair in that circumstance. Okay, so what happens at that point if science is working right? And Friedman should grab him and like, "Good God, man, what you've discovered," or like midnight conferences between upholsterers and cardiologists, or teams of idealistic young upholsterers sweeping across America and coming back with the news that no, you don't find chairs like these in podiatrists' offices. That's what should have happened. What happens instead? Here's where 90-year-old Dr. Friedman starts looking all sheepish. He says, "I told my nurse, get this man out of here. I'm this important cardiologist. I can't waste my time with him. Give him his damn check. Get him out of my face." He was too type A to listen to the guy. And it wasn't until about 5 years later that he collaborated with these psychologists, and back came the type A profile. And they said, "Oh my God, the upholsterer, he was right." To this day, they have no idea who that guy was. Now let's see, it is late afternoon in San Francisco. I'm willing to bet there's some bar in San Francisco right now where there's like this 110-year-old retired upholsterer. And get this guy going, and he's going to go on and on about how he discovered type A personality, exactly what occurred. So one of the dark chapters in my profession.
Thank you for watching my videos. I hope these videos are helping people who are experiencing some mental ailments like anxiety, depression, or agoraphobia. Please keep in mind, you are not alone and things will get better. Until next time, stay begruntled.